This is Paul Steinwald at the Center for Cosmetic Surgery here in the Denver, Colorado area. One topic I'd like to talk about is that our fully accredited outpatient facility can handle even more complex cases, such as those following massive weight loss. We are experts in doing extended abdominoplasties and or body lifts, as well as thigh lifts and arm lifts. Generally, I'm sure most of you who have lost major weight are aware, if you have not also seen it on TV, that massive weight loss leads to massive skin excess. Plastic surgeons are the experts in recontouring these areas with strategic incisions and making these procedures as safe as possible. Generally, a tummy tuck post-weight loss would involve an extended transverse incision and very occasionally a vertical incision as well to recontour the abdominal tissues as best possible. A body lift entails what is also called a belt lipectomy or circumferential lift, which will elevate the buttocks to a degree as well as the outer thighs. Oftentimes these procedures are also combined with liposuction. We like to perform a more classic brachioplasty with the scar hidden close to the posterior element of the arm, but to achieve maximum tightening of these structures, including the underarm or axillary area if necessary. All of our weight loss procedures can be performed as an outpatient with patients cared for at home by friends or family members. Oftentimes drains are placed at least in the abdominal or lower back areas. These are in place for 7 to 10 days and are removed in an appropriate time. Preoperatively in these post-massive weight loss surgeries, we are very careful to make sure you have optimal nutrition and are fully cleared surgically, working in conjunction with your primary care physicians as necessary. This helps minimize risks, ensure good healing and optimal results in general.